Ladies and gentlemen, this is an article that came out in The Hill, and I will leave the link to this article in the description box, dated January 27th, 2018. Our people are dying from the opioid plague. We need emergency funding. We are at the center of a complex and deadly opioid plague, and the statistics are staggering. Since 1999, overdose deaths have quadrupled. According to the Center for Disease Control and Prevention, Americans are dying at a rate of 91 a day from the opioid overdoses. And, well, Chris Christie said 175. So the principal driver of these deaths is illicitly manufactured fentanyl that is 50 to 100 times more potent than heroin, and carfentanil, which is 1,000 times more potent than heroin. There were 62,000 opioid deaths in 2016. Drug overdose deaths have surpassed peak death counts of gun, HIV, and car accidents. And remember, that 62,000 is only 22 states that reported to the CDC, not all 50 states. Last year, our state of West Virginia saw a record of 880 opioid deaths, the highest rate in the nation. In the fiscal year that ended in June 2017, officials in our state spent nearly 1 million transporting corpses. This epidemic is a series of associated epidemics, an epidemic of epidemics, including hepatitis C and HIV, neonatal abstinence syndrome, which causes babies to be born drug dependent, increased numbers of cases of endocarditis, and infection of the lining of the heart that may affect the heart valves. And you know what? When I first started doing videos on my old channel, I had came across an article that said the cardiologists around the country are now seeing patients as young as 22 years old with heart problems because of all the drug addiction going on. People need heart valve surgery in their early 20s because of all the years they've been doing heroin. And many of these people start doing heroin in their teens. So by the time they get to their early 20s and they're still doing it, they develop all kinds of heart problems. All right. Okay, so children abandoned or neglected to an overwhelmed foster care system by caregivers, and falls and fractures in older adults. There are victims of all ages in this crisis. Our local health department are the boots on the ground. We urgently need emergency supplemental funding to reduce the death toll and spreading of disease and harm in our state. See, that's why I keep saying, how do you declare this a public health emergency and say no money will be added to this thing? And that's all I read in virtually every article about how much money these people need in funding. So that couldn't possibly be right. Okay. White House Public Health Emergency Declaration. The White House called attention to the severity of the opioid plague by declaring a public health emergency and the need to address it in order to save lives. However, there is still an immediate need for a surge in resources. Resources require money. Dedicated funding in a coordinated federal, state, and local response. However, the declaration of an opioid public health emergency and not a state of national emergency does not go far enough. Local health departments like ours are dependent on increased federal funding from the CDC to battle a public health crisis that seems to escalate daily. We are fighting a battle in our community without the resources we need to be effective. We have not seen the release of federal funds at the point of contact at the federal health department level. Much more money is needed to implement the programs we know will help our communities. Astro requests 1 billion in emergency supplemental funding. Our colleagues at the Association of State and Territorial Health Officials recently requested the administration and Congress to provide 1 billion over 2 years in emergency supplemental funding for the CDC to allow health departments to address the opioid plague. Emergency supplemental funding would allow states and territorial health agencies to allocate additional resources for their top priorities, including strengthening public health surveillance to improve our understanding of the plague, expanding opioid misuse and addiction prevention campaigns, linking electronic health records and prescription drug monitoring programs, expanding partnerships and collaboration with law enforcement, expanding access to naloxone, and linking patients to medication assisted treatment and other services. So, in a nutshell, these people are saying to Trump, you know, you may have called this a public health emergency. We need money. Trump said there is not going to be any new money, no additional money. They have to make do whatever funding is there. And these folks are letting you know they simply can't do that. It's not enough. And there's already been several states complaining that since they declared this a public health emergency, the White House has done absolutely nothing on this whole thing. And I did a story just a few days ago on people on his opioid commission saying it's a sham. It's a sham. And you can go back and listen to that video. So at this point, it's safe to say, and I said this before, Trump is not going to help one single junkie out here. Not now, not ever. He's not going to help you. He was talking about making this a national emergency over the summer. This is now 2018. We're at the very end of January. And these states are screaming for help, screaming for funding. And Trump and his commission haven't gotten off their ass to provide nothing to any of these states. That's a big problem. That's a big problem. Local health departments like ours play a critical role in supporting the prevention of prescription and illicit drug overdoses by providing harm reduction activities, including syringe exchange, by coordinating with community partners, clinical services, and law enforcement, testing our communities for hepatitis B, hepatitis C, and HIV, and through the distribution of naloxone to save lives of users and protecting the health of our first responders. City, county, metropolitan district, and tribunal departments work every day to help ensure prevention and treatment options, and resources are available to those affected by the opioid plague. To do our job and protect the public's health, We must have the resources and tools to accomplish what we know needs to be done. Emergency supplemental funding is critical to begin to turn the tide in our communities before another generation is lost from this unprecedented plague. See, they already know a generation is already lost. And that was also something that I brought out last year. That's why they call this generation that's on drugs the lost generation. They know these people are gone. They know they are. And it's not much they can do. In this article, they said 62,000, but we will never have the real numbers, ladies and gentlemen. 22 states, you can almost probably damn near triple that number um, for the ones that died in 2016. But, I think they're ashamed. That's why they keep lowballing the number so they don't have to tell you the truth. Please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell twice and also join me over on Black Junction TV and blackspot.com. Peace, family.